Hello and welcome to the program Healthy Living on Trust Television. I'm Aisha Salihu. Nigeria is battling another disease outbreak, although in parts of the country, and this time it's diphtheria. According to experts, the disease is a highly contagious infection caused by a bacterium called Corynebacterium bacterium species that affects the nose, throat, and sometimes skin of an individual. Worldwide, the incidence of diphtheria has reduced dramatically in the past 5 decades, thanks to widespread immunization using a diphtheria toxoid-containing vaccine. The number of diphtheria cases reported to the World Health Organization declined from about 100,000 in 1980 to less than 10,000 cases in 2021. According to the Nigeria Center for Disease Control and Prevention, Kano State accounts for the majority of cases in the country. Now let's take a look at the situation in Kano.
Shi abu ne wanda Allah ya kawo shi. Idan muna fatan Allah ya yi wa al'ummar musulmi. Shi wannan larura bai fi kwana biyu ba. Farko abin da ya fara yi zazzabi ne haka mai zafi. To na kai shi aka dan samu magunguna aka bashi. To kuma dai so daga baya dai sai na ga abin da ya kamar ba zazzabin bane, shine na je na kai shi wajen ma'aikatan lafiya. Su kuma suka bani shawara suka ce ga inda zan tafi, inda zan je ci akwai masu kula da irin wannan laruras. To da muka kai shi a cikin kwana biyu, a ran da na kai shi a ranar Allah ya ɗauki rayuwarsa. Yawwa to illa muna dai fatan Allah ya yi mana wannan larura. Kanin Hassan ne, dan uwan wannan ne Hassan shine wanda so dama kafin su karbe shi dama sun nuna mun cewa zan inda suna da kannai na ce suka ce to zan kawo su a gwada su in an samu, in kuma ba samu ba akwai kwayoyin rigakafi wanda za a bamu wanda za mu zo gida mu dinga amfani da shi.
Da farko dai ni na fara ganin tana dan mashakar haka, to kwana kaɗan kuma sai zazzabi. Daga baya dai sai muka ga kuma nan gefenta da nan gefen diya kumbura. Kai abu da ya ƙi na kwasa muka je asibiti, abu da ya ƙi sannan aka dawo da ita. Bayan kwana kaɗan sai muka ga bakinta jini yana fitowa. To wannan abu da na ga haka kuma sannan ba ta iya cin abinci. Mun yi da ita abu ya gagara. In ma muka ɗura mata ko ruwa ne ka ɗura mata ba zai wuce ba. Sai dai ka ga kawai yana fitowa tare da jini. Na ce to abin nan fa ya fi ƙarfinmu. Muka sake koma asibiti abin da ya gagara. To shi kenan kuma daga baya dai kawai sai muka dawo da ita muka zube. To bayan da za mu yi. To shi kenan ka ji abin da ya faru wallahi. Akwai wasu guda biyu da suka fara yi amma su sun warke. Suna nan da ƙarami da babba.
Alhamdulillah wannan cuta ta daɗe da ɗan faruwa. Domin asarar mutane kamar a takaici mutum 3 ko 4 wanda duka sun rasa haka a nan areas kusa da nema. Ban da wanda suka rasu a takaici akwai mutum kamar 4 wanda suka kamu. Akwai shi wannan yaro Hassan, akwai gidan Malam Muhammadu guda 3 ne, an sallama 1, 2 kuma suna asibiti a kwanci. Yanzu haka abin da ake ciki kenan. To abin da muke so gwamnati ta kawo mana tallafi da magunguna da ɗauki da kuma rigakafi da kuma hanyoyin da za su ba mu shawara akan wannan larura. Allah ubangiji ta kaita mana ta wannan area da bare-bare. Yanzu alhamdulillah mun ɗau mataki, mun yi sallah ta asuba a masallaci, mun sa makirfan mun ga mutane cewa idan wannan cuta ta faru a rika tafiya asibiti da an ga yaro ina zazzabi haka ko ina zuwa da majina, wanda likitoci suka ga mana za ga yaro ina fidda majina da hancinsa, to kuma za a ga da zazzabi mai zafi a jikinsa. To muke faɗaukar da talakawanmu a je asibiti cikin gaggawa. To nan kusa muna wani asibitin na Mangwaro gashi nan gabar da mu. To anan ne muke zuwa muke tura mutane idan sun ji abin ya fi ƙarfi sai a tura Murtala. Don kuma Murtala can ake kwantar da mutane.
For diphtheria, it's a respiratory infection caused by a bacterium, Corynebacterium diphtheriae, and it manifests with flu-like symptoms: low fever, low-grade fever, that's temperature, cough, sneezing, running nose, conjunctivitis, that's red eye, and hoarseness of voice, that's voice cracking. And then in extreme cases, it comes down with neck swelling and a white patch on the tonsils, that is in the back of the throat. So that's what we call a pseudomembrane. Yeah, they share the flu-like symptoms, but like I said, there's this hoarseness of voice, there's this neck swelling, and then there's this white patch, which is the pseudomembrane, which is distinctive of diphtheria infections. You see, let's look at the risk factors. Anything that we say is a respiratory disease and spread through aerosols, that's by sneezing, the tiny droplets that one coughs or sneezes out. It's something that has to do with crowd. So staying in an overcrowded location with people coughing, one is putting him or herself at risk. And the second thing is the issue of sanitation. Coming into contact with someone or maybe an object that has a deposit of the diphtheria bacterium. Without proper sanitation, hand hygiene, one will also be at risk.
That means it is communicable.
It's communicable. It's communicable. It's communicable. Very, very communicable. So and then with the weather now, the season, you know, it's a very cold time, and then with that, people come down with a lot of flu. So the thing is, people shouldn't take it for granted. When you're having these flu-like symptoms, excessive coughing, or you come into contact with someone that's having excessive coughing, try to take measures, protect yourself, use your face masks. You see that face mask? It helps a lot. Use the face masks, practice proper hand hygiene, and if you think you have the symptoms, isolate yourself, reach out to the necessary health facilities, and then one will be guided on what to do next. We need to do more on awareness, because honestly, if we don't do more on awareness, we don't pray, we don't hope to see a situation, the COVID-like situation. But when we don't do awareness, then that means many people will come down with it. For instance, now within a span of just 2 weeks, in Kano we have more than 100 cases that were identified successfully. More than 33 people are dead in Kano. Recently, yesterday, I met a woman that has lost 3 out of her 4 kids to diphtheria. So you see, it's a very severe thing. So we need to do more on awareness. We need to tell people to be aware of it. You know, enlighten people so that they will know what to do and take the right and appropriate measures to tackle it. It affects all age groups. Age groups. Only that children are more susceptible. You know, they are young. Their immune system is not as robust as that of an adult, so they are more likely to come down with it. But that doesn't mean the adults are immune. The best thing that can protect someone is the vaccination. So an adult that is not vaccinated is as good as a child that is not vaccinated. So it's the same thing. So it has no distinction. So people should be vaccinated. For the children, it's part of the it's part of the expanded immunization program in what we call the pentavalent vaccine that deals with 5 diseases. So diphtheria is part of it. That's taken in 3 doses at the 6th week of life, 10th and 14th week of life. So that's how it is. So if someone takes just a dose or 2, he or she is not fully vaccinated. You understand? So also for adults. For adults, there should be a booster dose at 10-year interval, which most of us don't do.
It's indeed a sad one right there in Bare Bare and Tudun Rubodi communities in Ungogo local government area of Kano State. To make better sense of what the disease is and the measures taken by the NCDC to contain the scourge, we're now being joined by Dr. Bola Lawal, who is the team lead, the National Diphtheria Technical Working Group at the Nigeria Center for Disease Control and Prevention. Welcome to the program, Doc. And let's start up with disease epidemiology through surveillance and government's response so far.
Okay. Upon receipt of, or rather upon notification of the outbreak, last year, December, NCDC actually responded quite immediately, and we deployed teams to Kano as well as Lagos State to actually support the states in responding to this outbreak. Basically, where we supported mainly has to do with laboratory confirmation. Before now, there was limited capacity in the country for laboratory confirmation for diphtheria. We were able to do that with support from partners, of course, to establish capacity in country to be able to confirm diphtheria, which we are actually currently using at the moment. Apart from that, prior to now, we didn't have what we refer to as the diphtheria antitoxin, which is the mainstay in the management of diphtheria. So NCDC was able to actually request for this antitoxin from global stockpile, and it is currently being used in Kano State, Lagos, as well as Yobe State. So aside that, we've supported in area of strengthening surveillance by way of developing guidelines, case investigation forms, case definition, advisories, and we are actually supporting the state in training, creating awareness, particularly among healthcare workers, to aid them in effectively responding to this outbreak. So far, those are some of the things we've been doing.
Now, what would you say are the measures employed by the NCDC to control the scourge at the moment?
So essentially, to control this outbreak, there are a couple of things that need to be done. First and foremost, we need to be able to confirm the diagnosis of this disease in places where we pick up suspected cases. And to confirm this diagnosis, we require some form of laboratory capacity. Before now, laboratory capacity for confirmation of diphtheria in the country was quite poor, but we've been able to actually build up that capacity at the national level, and we are supporting state in also building their capacity to ensure effective confirmation of these cases. Like I initially mentioned or earlier mentioned, the mainstay of management of diphtheria is actually the use of what we refer to as the diphtheria antitoxin. Before now, this was actually not available in country, but we've been able to actually get some in country, and this is what we are currently using in managing the outbreak, particularly in states like Kano, Lagos, as well as Yobe State. We've also been able to come up with standardized case definition, case investigation forms, lab manuals, job aids, advisories that will actually assist in building the capacity of the states and particularly healthcare workers in effectively responding to this outbreak. So these are part of the things we've been doing. Aside that, we've also launched teams, RRTs, to these states, which includes Kano, Lagos, Yobe, Osun, and consider our teams. There are teams, RRT, the rapid response teams are actually currently in the state, supporting the state in part of what we are doing. Earlier in this year, we also haven't recognized the gap in laboratory confirmation across states in the country. We also scheduled a training here in Abuja, where we actually invited laboratory scientists and physicians across selected states in the country to build their capacity on how to confirm this or make diagnosis of diphtheria in the lab. And currently, the trained officers are in their respective states trying to support the state as well as build the capacity of other laboratory scientists in the states as well.
Now let's talk about facts and figures, number of infections and treated cases, case management.
Okay, so far in Kano State, Kano actually has the highest burden of the cases in country. They've reported over 200 confirmed cases and have equally treated over 150 cases in the treatment center that has actually been opened up consequent upon the surging number of cases they have in the states. So Kano is actually topping the chart with over 200 cases, and we've recorded about 38 deaths among these over 200 cases. We equally have Lagos, who have reported 14 suspected cases, out of which we've had confirmation amongst 2 of them, and these 2 confirmed cases unfortunately actually died. Yobe is actually reporting suspected cases as well, of which we've been able to confirm 2 out of that. Oshu reported 1 confirmed case. Katsina have also been reporting suspected cases, but none confirmed yet. So we've been actually receiving samples from across country, from different states across the country, where we actually test to confirm this outbreak. But so far, so good. Confirmed cases have actually reported in Kano, Lagos, UB, as well as Oshu states.
Thank you so much, Doug. What then are the prevention techniques for these diseases?
Okay, diphtheria being a vaccine preventable disease, the main mode of prevention is actually being vaccinated against disease. We have currently a safe and effective vaccine against diphtheria, which is actually given to children. So this is actually the mainstay when it comes to prevention against diphtheria. The other mode of prevention is actually to ensure that cases upon development of symptoms actually present early enough so that they can be treated with the appropriate antibiotics and, of course, with the diphtheria antitoxin, so as to ensure that they don't transmit these bacteria responsible for this disease from them, that is the infected individual, to susceptible hosts. These largely are the main preventive measures. Also, we strongly advocate states to follow up on contacts of confirmed cases. Following up contacts actually entails monitoring them regularly over a certain period of time to ensure that the moment they develop signs and symptoms suggestive of diphtheria, they are quickly managed so that they can actually reduce the risk of transmitting the disease to susceptible host. There's also the provision of use of some form of prophylactic antibiotics among contacts to ensure that people that have been exposed to confirmed cases are actually being prevented against the disease. So basically, these are the preventive measures, but topmost amongst them is actually being vaccinated against diphtheria, and this vaccination is mainly for now amongst children at 6, 10, and 14 weeks of life. 14 weeks of life, yes.
I know you've spoken a lot about vaccination and treatment, but still speaking about vaccine and treatment, let's look at the efficacy of medicines used in treatment. Who bears the cost of treatment, owing to the fact that the treatment of diphtheria perhaps may be relatively expensive, especially for people living in these rural communities?
Okay, I think on the contrary, the bacteria responsible for diphtheria is actually susceptible to cheap and readily available antibiotics. The books actually have reported the fact that this bacteria is susceptible to common and cheap antibiotics like the penicillins as well as the erythromycins. So it's actually cheap to treat. However, the major concern, particularly for confirmed cases, is the fact that they need to be treated with what we refer to as the diphtheria antitoxin, because it is really not the bacteria that is responsible for most of the complications that we see in diphtheria, patients with diphtheria, but rather it's the toxins being produced by the bacteria that is responsible for most of the complications, which at times leads to death. So the diphtheria antitoxin is actually a medication used to mop up those toxins from the blood circulations and prevent them from leading to the complications associated with diphtheria. So aside using the antibiotics, which are readily available and cheap, the diphtheria antitoxin is actually quite important in the management. Luckily for us, for now in the country, NCDC has actually made provision of diphtheria antitoxin, which has been supplied to affected states, mainly Kano State. This antitoxin are being offered to cases free of charge. So all patients benefiting from diphtheria antitoxin in country as we speak are not paying a dime for that. The vaccine is being supplied to the states free of charge, and the state actually administering it to cases equally free of charge. So that's the treatment for now. And luckily in Kano State, where we have most of our cases, kudos to the government of Kano State. All cases for now in the states are being managed in a treatment center being established by the state in collaboration with partners, and all cases seen in that treatment center are being treated free of charge, both with the diphtheria antitoxin as well as antibiotics and other medication. So for now, the government via the state government and of course NCDC is actually taking care of the basic needs in terms of antibiotics and the antitoxin needed for the management of these cases.
Thanks for that response. Now, in line with the disease management, I know the National Primary Healthcare Development Agency's mandate is on distribution of vaccines, but how's the NCDC working with the NPHCDA to ensure that this mandate is achieved in response to diphtheria disease outbreak?
Okay, NCDC has a very close working relationship with NPHCDA. We collaborate not just for this current outbreak, particularly diphtheria, but we actually collaborate with respect to other vaccine-preventable diseases, measles, yellow fever, meningitis, as well as COVID-19. So we have a good working relationship, and the collaboration is quite good. As a matter of fact, the technical working group being set up at the Nigeria Center for Disease Control and Prevention, NCDC, has NCDC manning one of the main pillar, which is actually the immunization pillar, and surveillance data that we actually gather from states is actually being used to inform some of the response activities at NPCD. So we have a good working relationship. Currently, NPCD have actually worked on intensifying routine immunization, particularly in the affected states. And together with them, we are looking at the possibility of reviewing our policies and working on provision for vaccination among older children, but particularly among healthcare workers who are actually at risk of this infection in the course of taking care of these cases. So we are quite working well with them, and we hope that such collaboration will lead to effective control of this outbreak.
Thank you so much, Doc. Finally, just before we let you go, let's get your final words of advice to Nigerians who are entertaining fear and panic for this disease outbreak.
So my final words would be, firstly, diphtheria is a vaccine-preventable disease. It's a safe and effective vaccine against diphtheria. So we strongly encourage mothers and caregivers of children, particularly children under 2 years of age, to ensure that they receive the 3 course of diphtheria vaccination, which is readily available across most of our public health facilities, down from tertiary to secondary as well as primary healthcare facilities, and equally available in some private health facility. Vaccination is the main mode of prevention, and we encourage mothers and caregivers to ensure that their children are protected. Then we equally strongly advise that members of the community actually develop signs and symptoms suggestive of diphtheria, which include things like fever, cough, catarrh, sore throat, neck swelling, at times difficult in breathing and swallowing. We strongly encourage them to present to the nearest health facility where we have our surveillance officers over there. They will be picked up and are key, and we shouldn't actually panic. Like I mentioned, diphtheria is actually the bacteria responsible for it is susceptible to cheap and readily available vaccines. The government of Nigeria, through the Nigeria Center for Disease Control, is actually making efforts towards making the diphtheria antitoxin more readily available for use, particularly for infected cases. So that will be my main message. You prevent ourselves using the available vaccines when cases come up early. When individuals are suspected of having the cases, they should present to the nearest health facility and ensure that such individuals are properly investigated and given the appropriate management.
We do appreciate you coming on the program, Dr. Bola Lawal, who is the team lead at the National Diphtheria Technical Working Group, the Nigeria Center for Disease Control and Prevention.
Thank you for having me. Bye for now.
It remains the responsibility of everyone to ensure safety and seek help at any health facility close by in an event there are evidences of symptoms of diphtheria disease. And remember, it spreads easily among people by direct contact or through the air and through respiratory droplets from coughing or sneezing. For comments, contributions, and suggestions on this episode, subscribe and follow us across all of our social media platforms. Join us again for another episode of the program, Healthy Living on Trust Television. I'm Aisha Salihu. Thanks for watching.